Coming up is a discussion with Rob English, someone who became a hair loss expert somewhat unexpectedly. Rob came up with an interesting hypothesis for why hair loss happens that addressed a couple of unexplained phenomenon seen in balding scalps.
Why is it that the same hormone that causes hair loss in the scalp seems causally linked to hair growth in the chest and in the face?
And Rob proposed a simple yet unique way for how to reverse it.
Now, these techniques, they're not behind a paywall. You don't have to pay anything to do them.
Rob even explains why Botox, of all things, that stuff people use for wrinkles, has led to significant hair regrowth in some people.
So around an 80% response rate and between an 18 to 21% increase in hair counts over a 6 to 10 month period.
In fact, the paper he wrote on this was accepted into an academic journal, and Rob's expertise became respected enough that now he is a journal editor. Here we have an in-depth discussion on Rob's unique model that may explain some instances of hair loss. In fact, this model may explain why Rob was successful in regrowing his own hair.
My name is Rob English. I am a medical editor. I'm a peer-reviewed researcher who specializes in hair loss disorders. And as of today, I've published 4 peer-reviewed publications on one of the most common types of hair loss that you can be diagnosed with as an adult. I also run the website perfecthairhealth.com, which showcases evidence-based approaches for hair regrowth with the drug model and without the drug model. It doesn't really matter to me which path somebody takes. What matters is that they're getting access to good information and that they're not spinning away trying really well-marketed supplements and topicals and devices.
These lasers that are helping you restore your hair, and it can be under a beautiful, fashionable hat.
In our full discussion, Rob actually covered all kinds of important aspects of hair loss, which I will upload later, but for this video, I've isolated just the explanation of his unique hair loss model that was published in 2017. One quick thing I need to cover first. Conventional wisdom says that the key cause for hair loss is DHT. Too much testosterone gets converted into DHT, DHT sits on the scalp and causes hair loss. The most popular drug for hair loss, finasteride, works by reducing levels of DHT.
I went and met the hair guy doctor. He put me on this medication. It's like a finasteride. Yeah. So I stopped taking the stuff about 3 years ago, and now I'm experiencing the hair loss.
Okay, let's get started.
But the reality is that there's some things that have yet to be explained by researchers in terms of how this condition advances. And I can give you a couple examples. So there's obviously a very strong genetic and androgenic basis to androgenic alopecia, but nobody really knows why DHT begins to increase in balding scalps. The other thing is that, researchers have partially explained the progression of pattern hair loss, but there's also some unknowns about why individuals who are undergoing hair loss and then completely reduce that hormone DHT, why do we only see a stop in the progression of pattern hair loss rather than a full cycle hair regrowth where our hair density returns to complete normal? And then another thing that I think is well under-researched is the fact that DHT is strongly associated with hair loss in the scalp in men and women, especially in adults. But DHT is also this hormone that's strongly associated with beard growth in the face and chest hair growth. So why is it that the same hormone that causes hair loss in the scalp seems causally linked to hair growth in the chest and in the face? And so this was the basis for the first paper, the hypothetical pathogenesis model that I proposed back in 2017. That model, the first thing that it did was catalog all of the other possible things going on in a balding scalp. And so when we start to zoom out, we notice that it's not just DHT that's elevated in balding scalp tissues. There's also a lot of other biological factors, tissue level factors, and then even anatomical factors that might be contributing to this condition. And so what we see at a biological level is increased levels of DHT. We also see increased levels of proteins and fatty acid derivatives associated with chronic inflammation. Now, at a tissue level, we see reductions to blood supply, and we also see reductions to oxygen. And this is another interesting thing. So we see these reductions to blood flow and oxygen in balding scalps. And the question is low blood flow a cause of that hair loss, or is it a consequence of hair loss? And there is some evidence to suggest that low blood flow actually might be a consequence of hair loss. And that's because hair follicle miniaturization occurs through hair cycles. And through these hair cycles, when the new hairs grow back, they grow back miniaturized, and that requires less vascular support. So the blood vessels supporting those follicles grow back in smaller. So there's a portion of that reduced blood flow that is absolutely coming from the fact that miniaturization is occurring and is thereby a consequence of the miniaturization. But there are also some research groups dating back to the 1990s that have argued that the reductions that we're seeing to blood flow in the scalp cannot be explained by these microvascular insufficiencies alone. There has to be some sort of potential anatomical trigger that is also contributing to the reductions in blood and oxygen. If you talk to dermatologists who are really familiar with feeling people's scalps who have pattern baldness, they'll say that about 80% of the individuals that they see with pattern baldness have really, really tight scalps relative to their non-balding counterparts.
Is that what makes the scalp so shiny?
So that is another feature that we see in balding scalps. We see parafollicular fibrosis or scar tissue that forms around hair follicles that are miniaturizing at their mid stages and at their end stages. And that can absolutely contribute to some of the shine. And we know that where there is scar tissue, hair can't really grow. So, you talk to these dermatologists and they say that, the scalp in men who are balding, 80% of these individuals have a very tight scalp, and that they seem to suggest that that tension seems to arise mainly from this involuntary and chronic contraction of the scalp perimeter muscles that basically round the entire top part of the scalp and are anchored to this dense fibrous membrane that underlies balding prone regions called the glea apparatica. And so when these muscles clamp down involuntarily and chronically, they tend to pull the scalp tight. So if you look at disease states that also involve things of chronic pressure or chronic tension or chronic muscular contraction, you tend to see the same patterns that we also see in a balding scalp. So in Dupuytren's contracture, it's this tendon-related condition where your tendons completely contract like this, and then your finger gets stuck. If you biopsy that tendon, you tend to see increases to 5-alpha reductase, you see increases to DHT, you see increases to transforming growth factor beta 1, you also see fibrosis. The same is true with prostates that are enlarged, and thereby under chronic pressure. You see increased 5-alpha reductase activity and DHT, increased inflammation, increased transforming growth factor beta 1, in some cases fibrosis. The same is true with the eyelids of patients who are suffering from Graves' disease, which is this thyroid disorder where your eyelids contract and your eyes kind of bulge out. If you biopsy those eyelids, you see the same histological markers that are involved in a balding scalp. And if you begin to look at the behavior of DHT, it's not always this thing that evokes hair growth or evokes hair loss. It's also this hormone that's used to mediate and arrive at sites of inflammation. And so knowing this, we can begin to potentially build a perspective about pattern hair loss that tries to fit in some of these other unique histological and morphological features that, in my opinion, get a little bit less attention. So the model that I proposed was that chronic tension from these scalp muscles here pulls the scalp tightly and creates tension across the top of the scalp. When you model the contraction of the frontalis and the occipital muscles, you pull those tightly. Fascinatingly, the tensile pattern that you generate across the top of the scalp perfectly aligns with the progression and the rapidity of male pattern hair loss. You see the tensile points highest at the temples and at the vertex. So there's some mechanistic data here that suggests that this tensile pattern might have some overlap with the tension generated from the muscles that have to be contracted in 80% of individuals dealing with this condition. Interestingly enough, if you change the head size of these two-dimensional models, you can also model the tension as diffuse, which would fit the patterning of female-related pattern hair loss. And so you look at these things and then you suggest, well, what I think might be happening is that tension that's chronic and involuntary, mediated from the contraction of these muscles, might be increasing inflammation as a response to that inflammation, DHT might be arriving to balding scalp sites. And we know that in states of chronic inflammation, when the inflammation is persistent, the DHT will likely remain in these scalp sites and begin to induce that transforming growth factor beta 1 protein. And the consequence of that is the laydown of scar tissue. And that might partly drive the rate limiting recovery limitations of androgenic alopecia, and maybe even part of the miniaturization process itself.
You might be thinking, okay, wait a minute. Terry Crews has a super flexible scalp, but he's bald. Actually, he's not bald.
I am really not bald.
Wow,
at all. I shave
weird.
my head every day.
So again, I want to be absolutely clear that this is a hypothetical model, and that, you look at this data and you think, okay, there's some mechanistic data to support this. Then the question becomes, is there anything that actually suggests that relaxing these muscles might improve hair loss outcomes and potentially even DHT? Well, interestingly enough, there was a study done in the early 2000s, or an initial trial done by this researcher, Dr. Brian Frund, who's a university lecturer in Toronto. He's now retired, but he's also an internationally recognized expert on something known as botulinum toxin, which is Botox. Botox is a neuromodifier that helps to relax muscles. And he was dealing with patients who had tension headaches, and he wanted to test whether or not he could take these muscles out of chronic contraction, which seemed to have some pathological overlap with tension headaches, and see if these muscles, if you take them out of chronic contraction, you could improve their headache outcomes. And so he started to do some tests on his own patients, and they kept coming back with anecdotes about how they were seeing improvements, but they were also seeing improvements to their hair density. He thought that was really interesting. And so he did the injections on himself and his business partner, and they found the same thing. Yeah, they were getting improvements to hair counts just by relaxing these scalp perimeter muscles, just through Botox injections. So they brought these findings to the makers of Botox and set up a clinical trial to test whether or not Botox might improve androgenic alopecia. And so they set up the trial such that they had all of the men make sure that they weren't doing any other hair loss treatments. And they brought them all in, and they did between 100 to 150 units of Botox injections into all of these muscles around the scalp perimeter. And then they brought them in 5 months later, because the relaxation effects of Botox tend to last about 4 to 6 months. And they had them do another round of injections. And they measured hair counts then, and then they measured hair counts at month 10 after having these muscles chronically relaxed for a period of 10 months. And what they found is over a 10-month window, 75% of individuals responded favorably to Botox in terms of stopping or improving their hair loss. And they also found an 18% increase in hair counts overall, which was really encouraging. It's a pretty significant finding. So I saw this as some evidence that maybe this hypothesis held some merit. And then also on the Botox data, Dr. Frund's study demonstrated a 75% response rate. So it's not 100%. If it were 100%, that would suggest that we found the root cause of pattern hair loss, and we can all celebrate and start getting Botox for the rest of our life. But obviously this suggests that these things might be an accelerator. So that's what I argued in my 2017 paper. I published that, and since then, there have been several investigations mimicking Dr. Frund's trial. There have been 3 studies that have come out that did these intramuscular injections and basically found the same exact outcomes, sometimes even better. So around an 80% response rate and between an 18 to 21% increase in hair counts over a 6 to 10 month period. In fact, we even just published a literature review. This was our 4th peer-reviewed paper. We published a literature review on this just last month. So you can read these studies and learn about their methodologies for free. So these are some of the environmental things that I think can absolutely impact a balding scalp. Not the only environmental things. There are things like dermatitis and malassezia overgrowths and P. acnes overgrowths that can happen in the sebaceous duct. But I think that these scalp muscles are potentially involved in a number of individuals suffering from androgenic alopecia overall. And what I like about this is that they kind of offer this unique target outside of the drug model. So obviously the drugs work really well.
It's like a finasteride.
So Don't just skip the drugs and try to target scalp tension because you want to. But the Botox data into these intramuscular injections seem to suggest so far that things seem to improve when you do hair counts at the top of the scalp, and that those improvements are cosmetically perceptible in some cases. And there's also been a study that combined Botox with finasteride, and over a 6 to 10 month period saw a almost 35% increase in hair count. And that is absolutely cosmetically significant. It seems to suggest that these things might be targeting different things, or that they might be complementary or synergistic to each other.
Okay, Botox is this weird thing where you inject it into this part of the head, and then you're getting regrowth in hair. And so the thing that most likely is explaining that is the fact that these are relaxed. You know, these are all tightened up. That causes the scalp to tighten up. It creates this environment where it's more likely for DHT to be produced. But then people might be wondering, like, what causes it to get so tight? Like, do some people have really tight scalps and other people don't have tight scalps? And what's making it tight?
It's a great question. I mean, I'm sure that some of this is genetically predetermined to a high degree in the womb and then in early childhood development, depending on the amount that we chew, the way that our jaw develops, that will influence the structure of our skull, the way that our sutures settle into early adulthood, our androgen exposure overall. I mean, there's this condition called polycystic ovarian syndrome in women that is often characterized by an overexpression of androgens. And it happens specifically in the ovaries, and these women develop male-like characteristics. So they'll develop hirsutism, which is facial hair growth. They'll also develop pattern hair loss. It's an androgenic influenced condition, but when you measure bone mineral density in their scalps itself, their skull bones have a higher bone mineral density. So the effects of androgens themselves might also influence bone development. And these things can get set, you know, in early childhood, in development, and then become potentially problematic later on. So there's just a lot of factors that we don't really know why these muscles might contract. Again, the data suggests with this Botox stuff that 80% of individuals who have androgenic alopecia, who are men, tend to have these tighter scalps. Doing these injections themselves, they seem to improve hair counts overall for about 80% of individuals. When I talked to Dr. Frund about his initial investigation, he said that you could predict a top responder to Botox by just telling whether somebody had a tight scalp or not. That tends to be strong information to suggest that that's what's going on here. At the same time, we don't have any studies demonstrating that when you inject Botox into these scalp perimeter muscles, we've measured blood flow before and after at the top of the scalp or oxygen levels. We just don't know if that's the exact mechanism of action for Botox. But this is what I speculated in that 2017 paper as a potential environmental factor or anatomical factor that might accelerate the onset of androgenic alopecia and potentially be one of the main drivers for people who have really, really tight scalps alongside androgenic predisposition. What's interesting is that there have been other research groups that have postulated similar things. So there's individuals in the 1990s, there was a study by Dr. Goldman who measured transcutaneous oxygen levels in balding regions and found that in the frontal region of the scalp, where there was hair loss, there was about a 40% decrease to transcutaneous oxygen levels and very likely blood flow. And in that paper, he argued that dihydrotestosterone, DHT, is this hormone that occurs even in the absence of oxygen. And so when free testosterone can convert into something else, it can become an estrogen, like estradiol, and that conversion is oxygen dependent. You need moles of oxygen to create that conversion. But then for DHT, you don't need any oxygen. And his research group argued that maybe some of the reductions to blood flow and oxygen that we're seeing in balding regions are creating an environment whereby DHT might be favored and thereby expressing at higher levels. So in my model, I argued that it might be inflammation that's sending DHT. Again, there's a chicken and egg problem here because DHT can also induce inflammation through transforming growth factor beta 1. So we just don't know. In his model, he argued that there might be some sort of anatomical or structural element that is lowering oxygen levels, and then DHT levels start to increase in balding regions.
Okay, so he's saying that basically it looks like low oxygen environments favor the conversion into DHT. Essentially, low oxygen environments equal, kind of, more hair loss.
Yeah, exactly. So, and this is actually supported by some mouse studies. So there is this term for poorly oxygenated environments, hypoxia, but it's also ischemia. And when you look at ischemic mice, when you reduce blood flow and oxygen levels in a specific tissue, mice will also start to undergo hair shedding and potential miniaturization. So there are some studies to support these assertions. It just gets really complicated because there's an element of cause and effect here. We know that hair cycling itself can lead to the consequence of lower blood and oxygen levels. And then we have these anatomical elements that also might be lowering blood and oxygen levels. So delineating how much might be from one thing and how much might be from other things, we're kind of at a research limitation there. So I don't want to overstate any of this, but it's just an interesting pathogenic model that I find to be really relevant. And it actually was part of the reason why we published our second paper, which was on a solution outside of Botox to help target these things, which happened to be something that I used to see significant hair improvements.
Before we get into what Rob did to regrow his hair, I'd like to quickly thank NordVPN for sponsoring this video. The other day I was looking for a movie to watch, something with Bruce Willis or Patrick Stewart. But many of the movies that looked good were not available for me to watch because I'm in Japan. Now, personally, I would rather not have my internet service provider be telling Netflix specifically where I'm located. That's where the sponsor of this video, NordVPN, comes in. Check out nordvpn.com/whatI'veLearned for a huge discount on your plan. With Nord, I can keep my internet activity private from my ISP, and I can even create the illusion that I'm actually in a different country, so I can still watch this video or any other content that is only available in America, Australia, or any of the other nearly 60 different countries where NordVPN has its 5,800 plus servers. I usually have the VPN going on my laptop so I can keep my data safe while I'm at the cafe or using public Wi-Fi. NordVPN is the fastest VPN out there, and the monthly cost is only about the price of a cup of coffee. And they're offering a huge discount off your plan at nordvpn.com/whatI'veLearned.
The reason why I started Perfect Hair Health was because I had been doing these specific standardized scalp massages that had been really leading to cosmetic degrees of hair improvements. And that I'd read a lot of this research and I found it really interesting. And I found that you could target the relaxation of these scalp perimeter muscles with hand-based presses, and that you could also evoke tension relaxation, according to tension headache studies, potentially to the same degree that you could with botulinum toxin injections. It's just that you'd have to do the exercises more regularly. Simultaneously, we know that treatments like platelet-rich plasma therapy or stem cells or adipose-derived stem cells plus A cell, these things tend to work predominantly, most likely through inflammation generation. And there was evidence that scalp massages through acute inflammation generation could help to attenuate fibrosis in other human trials for things like burn victims. And so cyclical-based massages and acute inflammation efforts that were done with your hands might be able to mimic the effects of these other inflammation-based therapies that were also leading to hair counts. And so the research that we began to accumulate centered around basically using your hands to help massage the scalp perimeter through scalp presses, and then also acute inflammation generation across the top of the scalp through specific skin pinches and presses and stretches. They would hopefully elicit the same mechanisms by which we knew or suspected these other regrowth modalities to work. And so later on, research began to develop from microneedling, these medieval torture devices that have these tiny little needles on them, that you could roll these over your scalp and they help to enhance drug delivery and potentially the activation of drugs like minoxidil. But that even in the control groups for these studies that were just doing microneedling alone, you would see improvements to hair counts overall. And then also there were studies that began to emerge for scalp massaging using devices that, in addition to your hands, could be used to help improve hair thickness by 10%. Although those studies were done in non-balding adults. So not necessarily a comparable metric, but nonetheless, another signal that you can say, okay, maybe this might work for people losing their hair as well. And so when I began to see improvements from these exercises, I started to share them for free on our website. And basically, the website was like a donation-based site where people could try these things. They could read about the speculated mechanisms. And then over time, more and more anecdotes started to grow of people seeing success. And then we launched a study. It was a survey-based study to determine how people responded to these things over time. And so what we ended up finding from the data was that there seemed to be a time-dependent increase in effectiveness for these massages. So over an 8-month window, if people massaged for 8+ months or longer, from 10 minutes daily and beyond, on average, people reported a 75% response rate, meaning that they self-reported stabilization from these efforts or some improvement, with the degree of hair regrowth varying significantly depending on the individual. And that those results tended to trend upward the longer that somebody committed to these exercises. And we just found that data to be really encouraging. So we submitted it to a dermatology journal and it was published. And that kind of evoked more interest in these standardized scalp massage techniques. Now, these techniques, they're not behind a paywall. You don't have to pay anything to do them. I can even share a link with you because as part of the publication for that study, we also published the demonstration video that we showed to everybody, as well as the PDF instructions. So you don't have to pay anything to try these things, but it seems to have overlapping mechanistic research with the things that we just discussed alongside these acute inflammation exercises. And it happened to be something that worked really well for me. Now, I want to preface again that the massages are an interesting intervention, but let's talk about data quality for a second, because this is something that we like to talk about on our website. The drug finasteride, the drugs minoxidil, dutasteride, these things are supported by tens of thousands of patients across 30+ years of research. When we look at the data on these scalp massages, we have to contextualize the improvements based on the quality of research overall. We are talking about survey-based studies from self-reported individuals, which is the beginning stage of research, but it is absolutely not the gold standard for research. There were no hair count studies that were done on, these standardized scalp massages. So we have to interpret this survey data with a degree of caution and recognize that it's very, very low on the hierarchy of evidence. And in addition to that, the mechanisms supporting the scalp massages are speculative. We have reason to believe that they have to do with the relaxation of these scalp perimeter muscles. We have reason to believe that the acute inflammation that's generated from the top of the scalp overlaps with the acute inflammation that seems to evoke hair count improvements in microneedling studies and in PRP-related studies. Do we know that they absolutely improve hair loss for 75% of people? Absolutely not. This is just a beginning start of the research here. Do we know exactly how they work? Absolutely not. Nonetheless, a lot of people have used these things and seen significant improvements. In fact, we have some evidence of this on our site of people who have been trying these massages for extended periods of time, and even at the 1-year mark have noticed cosmetic degrees, 1.5, 2 years, sometimes even 3 years, these slow linear improvements to hair counts overall, which seemed to suggest to me that for a portion of individuals, this seems to work well. Now, how big is that portion? I don't know. They certainly worked for me. Are they going to work for everybody? Not necessarily. And so we have to balance that evidence like we would with all interventions against the options that are far easier to implement. Finasteride, minoxidil, other things like that. But yeah, it's just what works for me, and it worked really well. And this was coming from somebody who got fear-mongered away from FDA-approved drugs and probably should have made a decision that was a little bit better when they first started losing their hair. This is also coming from somebody who tried minoxidil and was a non-responder, unfortunately, and then low-level laser therapy devices and was a non-responder to that. And so I was fortunate enough to find something that worked well for me. And it's just an interesting thing because we've also seen in some cases on our website, individuals who have stagnated from hair regrowth using things like finasteride or minoxidil. Then they introduce the massages and all of a sudden they regrow a significant amount of hair. There are just some photo events that they might act as an adjunct to these FDA-approved treatments. But again, they're entirely free. You don't have to pay anything to do. In fact, one of the tenets of our website is to publish open access peer-reviewed papers for everybody. So I don't want to make it sound like somebody has to buy something to get hold of these.
As mentioned, I'll upload the rest of my discussion with Rob where we cover many other important aspects of hair loss later, but for now, go ahead and check out his impressively thorough educational website, perfecthairhealth.com, and his YouTube channel is also called Perfect Hair Health. And if you're interested in seeing this specific massage technique Rob talked about here, check out the description for a link to that.